Hello and welcome to the Housing Authority of the City of Austin 2021 Enrollment Webinar. My name is Sandra Quintanilla with Gallagher Benefit Services, and I'll be walking you through your options for this plan year beginning April 1st, 2021, that's lasting through March 31st, 2022. We know that insurance is very important to you and your family's well-being, and I'm going to explain the many wonderful features of your benefit plans. My goal is to make sure that you have a general knowledge of how the plan works. So let's get started in reviewing your benefits that's offering beginning 2021 through the 2022 plan year. The Housing Authority of the City of Austin is extremely excited to announce that United Healthcare will continue to be the medical carrier for employees and their dependents. The Housing Authority will be offering the same exact copays, deductibles, and pharmacy copays. They will continue to offer the EPO, which is an exclusive provider organization, which has no out-of-network benefits. The Choice Network will continue to be the same network to search for providers. Virtual visits will remain the same. Dental, basic life, and vision will have no changes. The voluntary life and AD&D, voluntary short-term disability, long-term disability, critical illness, and voluntary accident have no changes. The Benefit Advocate Center will continue to be offered for the Housing Authority of the City of Austin. Another great benefit for the Housing Authority of the City of Austin is the Benefits Advocate Center. This benefit is administered through Gallagher Benefit Services and is a great one-stop shop for all your benefit needs. The Advocate Center is a great resource for you to call if you have any questions about a specific claim or your coverage in general. This number can be used for all your benefits, including medical, dental, and vision. Open enrollment is the one time a year that you can make a change to your benefits. The open enrollment period for eligible employees will be March 9th, 2021 through March 23rd, 2021. All benefits will be effective April 1st, 2021. Open enrollment applies to the following benefits: medical, dental, vision, voluntary life, and accident, death, and dismemberment. EOI, evidence of insurability, is required for new elections and increasing current amounts by more than one level or multiple of your basic annual earnings. Flexible spending account, FSA, and dependent care. Voluntary short-term disability, new elections will require an evidence of insurability form. Cancer, critical illness, and accident all fall under open enrollment. Open enrollment is a one time of year where you could make changes to your plan designs. You may also make changes to your elections if you have one of the following qualifying event status changes during the year. The IRS regulations require for the enrollment due to the qualifying events above, changes must be submitted to your benefits office within 31 days of the qualifying event. A qualifying event includes marriage, divorce, birth of a child, adoption, death of a spouse or dependent child, termination of spouse's employment, change of employment status by you or your spouse, a significant change in your spouse's health coverage due to your spouse's employment, qualification by a plan administrator of a child support order, entitlement to Medicare or Medicaid, and loss of COBRA coverage. The medical insurance will be continued to be administered by United Healthcare. Medical overview. The Housing Authority of the City of Austin will continue to offer an in-network plan only, which is an exclusive provider organization plan. The lifetime benefit maximum is unlimited. The calendar year deductible is $500 for an individual and $1,000 for a family. The calendar year out-of-pocket maximum includes your deductible, co-insurance, and copays is $2,000 for an individual and $4,000 for a family. The co-insurance is at 100%. For a primary care visit for ages 0 through 19 is a $0 copay. Age 19 plus is a $25 copay. For specialist visits, for a designated specialist is a $25 copay. For a network specialist is a $50 copay. Wellness care, routine exams, immunizations, well baby care, and mammograms are covered at 100%. Generic copays is a $10 for the prescriptions. For formulary drugs is a $30 copay, and for non-formulary prescriptions is a $50 copay. Medical overview details. Emergency room facilities is a $300 copay. Emergency room physician charges are included in the facility. For hospital services and surgeries, for inpatient and outpatient services are covered at 100% after deductible. For mental health services for inpatient are covered at 100% after deductible. Outpatient services in office are $25 copay. Other services visit limits are per calendar year. Maternity services are covered at 100% after deductible. Physical, occupational, and chiropractic therapy are covered at 100% after deductible. It's 20 visits per each. The urgent care is a $75 copay. When you are sick or need medical care, it is important to know where to go for treatment, so you and your loved ones get the care that you need. Understanding your options now helps you to be prepared when you need to seek treatment, and it helps you understand how to use your options wisely. Let's all take part in controlling our costs by using the appropriate level of care. Telemedicine providers are licensed physicians, nurses, and physician assistants who will listen to your symptoms, diagnose your condition. If needed, they can prescribe you medication. Telemedicine treatment is appropriate for the following concerns: cold and flu symptoms, bronchitis, urinary tract infection, sinus problems, and pink eye. It is often a low-cost alternative to an office visit. If the care needed does not require a personal visit with a doctor, it is also very convenient. Doctor's office. This is the place to go if you are not experiencing a life-threatening emergency. It is beneficial to develop a relationship with your primary care physician so that they can know your health history and can identify when things have changed. See your primary care physician for annual checkups, preventative care visits, flu shots, and recurring issues. Convenience care or minute clinic. These are walk-in clinics located in retail stores, usually staffed by a nurse practitioner or a physician assistant, and treat uncomplicated minor illnesses such as common infections, minor skin conditions, and flu shots, minor cuts, and earaches. Urgent care clinics. If your primary care physician is not available and you need a quick medical attention for a non-life-threatening problem, visit an urgent care for sprains, strains, minor broken bones such as a finger, minor burns, and earaches. If you have a life-threatening situation or late-night trauma, go to the emergency room. If a situation seems life-threatening, call 911 or your local emergency number right away. Important UHC benefits. United Healthcare member login is www.myuhc.com. UHC member app provides you an estimate for healthcare cost. Check your explanation of benefits after every visit. Prescription drugs. Price your medication. Ask for generic alternatives. Preventative care are covered at 100%. After-hour clinics, urgent care versus emergency room. It's so important to make sure that you visit your telemedicine provider for little to no cost. You also could get rally discounts and real appeal for weight loss. The Housing Authority of the City of Austin is pleased to announce that the rates for the 2021-2022 plan year have not changed. Please take an opportunity to review the benefits for the upcoming plan year. The dental insurance will continue to be administered by United Healthcare. The Housing Authority will continue to offer the DHMO and the PPO plan. The DHMO is considered the low plan and only has in-network benefits. This plan does not have a deductible for an individual or for a family, and there is no calendar year maximum. However, it's extremely important for you to find a primary dentist. Make sure that you go to myuhc.com to search for primary dentist. If you go out of network, there is no coverage. For preventative, basic, and major services, everything is based on a fee schedule. Please take a moment and review the plan document that will be available to you on the HACA portal. This information will have the American Dental Association codes, and everything will be tied to that fee schedule. The PPO plan has a deductible of $50 for an individual and $150 for a family. The calendar year maximum is $2,000 per person. The deductible is waived for preventative care. Preventative care includes cleanings, x-rays, and oral exams are covered at 100%. Basic services are covered at 80%. A $50 deductible applies. Keep in mind, your deductible is per calendar year. Fillings, root canals, and oral surgeries are covered at 80%. Major services are covered at 50%. Major services include crowns, inlays, onlays, bridges, and extractions. Orthodontia coverage is covered at 50%. The deductible is waived. Orthodontia coverage on the PPO plan is for children only up to the age of 19. The lifetime maximum per person is $1,000. The out-of-network benefit is the 90th percent of the reasonable and customary charge. This plan does have in and out-of-network benefits, but it's extremely important for you to find an in-network contracted dentist. If you go out-of-network, you can be balance billed. It's always important to ask for a predetermination for services that are over $300. A predetermination will confirm how much the insurance will or will not pay. A couple of red flags is do not pay up front for the charges until that claim has been processed by United Healthcare. What happens if I go to an out-of-network dentist? Utilizing an in-network dentist will provide you the best benefit. Below is an example of an in-network versus out-of-network coverage. For an in-network preventative visit, charge is $150. The amount that United Healthcare pays a dentist for a contracted rate is $80. You will owe $0. If you should go out-of-network for a preventative visit, it's $150. The amount that United Healthcare will pay, the usual and customary charge, is $125. You will owe $25 for the out-of-network visit. You can visit myuhc.com to find an in-network provider. Choose the national option PPO 30 network. Choose the Texas DHMO for the DHMO network. You could only switch between the two plans at open enrollment. Dental rates. The Housing Authority of the City of Austin will continue to pay 100% of the DHMO rate and 90% of the DHMO rate for dependents. Please review this diagram for the United Healthcare DHMO dental premiums for yourself and your family and the United Healthcare PPO dental plan premiums for the upcoming plan year. The Vision Plan will continue to be administered by United Healthcare. Vision Overview. For in-network benefits for an eye exam, it's a $10 copay. Prescription glasses is $25. Frame allowance is a $130 allowance plus 20% off of remaining balance. Contact lens allowance is $125. The frequencies for an eye exam is once every 12 months, lenses it's once every 12 months, and frames it's once every 24 months. The Vision Plan will cover glasses or contacts. You may visit www.myuhc.com to find your in-network provider. The network for United Healthcare is Spectera. Your vision benefits will not reset. Frequencies will go from the last exam materials fill date. Vision rates. The Housing Authority of the City of Austin will continue to pay 100% of the employee-only rate and 90% of the dependents. Please see this diagram for the amount that you would be paying per pay period for the vision benefits. The life insurance and accidental death and dismemberment will continue to be administered through the Hartford. Basic life and accidental death and dismemberment overview. The Housing Authority of the City of Austin will continue to pay 100% of the basic life insurance. The basic life insurance benefit is 1 times the annual salary. The maximum benefit amount is up to $200,000. There is an age reduction schedule that your benefits do reduce 35% at age 65 and again 50% at age 70. The voluntary life and long-term disability will continue to be administered by the Hartford. Voluntary life and AD&D overview. You have the option to elect additional life and AD&D insurance at a group rate. Voluntary life and AD&D benefit for the employee is a lesser than 5 times your earnings or $500,000. For your spouse, you can elect up to 100% of the employee amount or $100,000 or at $5,000 increments. For children, 15 days to 26 years is a $10,000 election. Your current voluntary life and AD&D elections will continue with no additional questions asked. If you want to add coverage for the first time or increase your coverage, you will need to submit an evidence of insurability. Coverage or increase will be effective once approved. The long-term disability overview. The Housing Authority of the City of Austin will continue to pay 100% of the long-term disability benefit. The benefit is 60% of your earnings up to $6,000 per month. The elimination period is 90 days. The benefit duration is benefits end earlier or of the physical determination of normal Social Security retirement age. There is a pre-existing condition. It has a limitation of 3 months. It goes back 3 months to see if you were diagnosed, treated for, or taken medication, and if you were, that condition will not be covered for 12 months. If you are a new employee, this will only apply to you. If you're an existing employee, your waiting period has been waived. The Employee Assistance Program will be administered by Alliance Work Partners. The Employee Assistance Program is also available to employees and to your dependents when you have questions or concerns or emotional issues surrounding your personal or work life. You can use the EAP to help. The EAP is through Alliance Work Partners and is 100% confidential. Additional resources are Plan Well, Well Coach, Work Life, Law Access, Safe Ride. The Employee Assistance Program is there to assist with complex, sensitive issues. You have 1 through 6 visits, face-to-face visits, free of charge. It's available 24 hours a day, 7 days a week. You may call 1-800-343-3822. You can also access resources online at awpnow.com and create a customized account. Go to www.awpnow.com, select Access Your Benefits. Registration code is AWP-HACA-4415. Flexible spending accounts. A health flexible spending account is a pre-tax benefit account used to pay for eligible medical, dental, vision care expenses that are not covered by your insurance plan. Access to the full amount of your account is available day 1 of your plan year. You can save an average between 25 to 30% on eligible healthcare expenses. The health FSA per plan year maximum is $2,750. A dependent care spending account is a pre-tax benefit account used to pay for out-of-pocket work-related dependent care costs. If you're married, you can use the account if you and your spouse both work. Single employees can also use this account. You only have access to those dollars that have been deducted from your paycheck. You can save an average between 25 to 30% on eligible dependent care expenses. Dependent care maximum is $5,000. Remember, you must keep all your itemized receipts. This is an IRS regulated account. This also has a use it or lose it provision. Enrolling online and finalizing your open enrollment. Please feel free to contact Sandra Quintanilla or Gallagher Benefit Services if you have additional questions or concerns regarding your open enrollment. Thank you. Thank you so much for attending the open enrollment for the Housing Authority of the City of Austin for the plan year beginning April 1st, 2021 through March 31st, 2022.